All right, so I actually got a little bit of good news here for you guys on the ongoing global vaccine apartheid because the radical and terrifying socialist government of Cuba is deciding to actually try to do something about the current status quo of private for-profit big pharmaceutical corporations dominating the global distribution of vaccines and basically creating a situation where wealthy Western countries have almost fully inoculated our populations with vaccines while entire continents like Africa have had essentially no reasonable access to the vaccines. So I got a great breakdown here for you guys from CNBC talking about how much of an absolute feat this is for them to be doing this while, reminder, under a continued embargo by the United States. So let's just go ahead and get into it. They say why Cuba's extraordinary COVID vaccine success could provide the best hope for low-income countries. So they say Cuba has vaccinated a greater percentage of its population against COVID-19 than almost all of the world's largest and richest nations. And in fact, only the oil-rich United Arab Emirates boasts a stronger vaccination record. And they say the tiny communist-run Caribbean island has achieved this milestone by producing its own COVID vaccine, even as it struggles to keep supermarket shelves stocked amid a decades-old U.S. trade embargo. And just to remind you guys on how absolutely batshit crazy the existence of this embargo actually is, okay? Not only has it cost the Cuban government and therefore the Cuban people hundreds of billions of dollars over multiple decades in potential economic growth, but in addition to that, okay, literally only the United States and Israel are, in the entire global population, in the entire world, are the ones who are still supporting this embargo, okay? Just as a reminder here from June of 2021, Israel, again, is the only country to support the U.S. as the UN condemns the Cuba embargo. So everybody else around the world seems to understand how completely absurd and violent and terrible this embargo actually is, except for the United States and Israel, apparently. So again, just completely wild that this embargo even exists in the first place. But they continue saying that to date, around 86% of the Cuban population has been fully vaccinated against COVID with 3 doses. Okay, that is wildly ahead of where the United States is right now. And another 7% have been partly inoculated against the disease, according to official statistics compiled by Our World in Data. So almost their entire population, okay, has been fully vaccinated with 3 doses, okay? That's even way ahead of where the United States is at right now. We barely have like 70% of our population fully vaccinated with 2 doses. So they continue explaining how exactly they went about doing this and what their vaccine actually looks like, because this is an important part of this, how they chose to develop their vaccine so that it would specifically be easier for other countries to produce this vaccine as well. So they say that Cuba's prestigious biotech sector has developed 5 different COVID vaccines, okay, including Abdala, Soberana O2, and Soberana Plus, all of which Cuba says provide upwards of 90% protection against symptomatic COVID when 3 doses are administered. And they say that unlike U.S. pharmaceutical giants Pfizer and Moderna, which use mRNA technology, all of Cuba's vaccines are subunit protein vaccines like the Novavax vaccine, and crucially, for low-income countries, they are cheap to produce and can be manufactured at scale and do not require deep freezing. So again, this is a really important part of this, because part of the reason why, even if there were no patents that were protecting these gigantic pharmaceutical companies from having to share their vaccine recipes and know-how with the rest of these production facilities around the world, one of the more difficult parts about, the Pfizer and the Moderna vaccines is that they have to be kept in these, freezing conditions, and it's very difficult to transport them, especially if you're talking about, a widely dispersed continent like Africa. It would be pretty difficult for them to ramp up that production, but making a different style of vaccine like this that doesn't require some of those more, intensive procedures to administer the vaccines is that's a gigantic fucking difference. Okay, so it's absolutely amazing that they decided to go about it in that way. But they also point out that he also pointed out that Cuba, unlike other countries or pharmaceutical companies, had offered to engage in the transfer of technology to share its vaccine production expertise with low-income countries. Again, this is a main component of this. This is what basically the TRIPS waiver that was put forward at the World Health Organization was suggesting that the U.S. originally was blocking. Biden says he now, doesn't support blocking it, but you still have wealthy Western imperialist countries that are preventing these patents from being released so that all of these different, dozens and dozens of production facilities around the world could ramp up that production to administer the vaccines to their own domestic population. populations. But Cuba, they're basically saying any country that wants it or needs it can have access to our recipes. But not only that, but as you can see here, they are going to be extending medical brigades to build medical capacity and training for vaccine distribution in partner countries. They're going to be doing technology transfer where possible for production in low-income countries, and also going to be giving them solidarity prices for the vaccines for low-income countries. So not only are they, trying to help it facilitate distributing these vaccines, but they're also giving them their technology for the vaccines. And on top of that, they're going to help them to ramp up the production. Okay, I mean, this is the same country that we saw early on in the pandemic exporting their doctors across the world. Okay, and none of this is an accident. Okay, including the absence of the vaccine hesitancy, as they point out down here. Right, you can't vaccinate, damn near over 90% of your population unless you have, virtually no vaccine hesitancy, or I guess unless you're going to go and hold everybody down on the ground and force them to get vaccinated. But they didn't have to do that. And why didn't they have to do that? This is just as important as even the vaccine side of this story. The reason why they were able to produce these vaccines, the reason why they were able to get 90% of their population fully inoculated with 3 doses, is because of how they have chosen to invest in public healthcare. Okay, that is the key difference between the United States and a more socialized medical system like Cuba has. Okay, that is a key difference, and this is why I talk about all the time on this channel nationalizing big pharma to remove the profit motive, and in addition to that, nationalizing our health insurance system so that everybody has free health insurance and you can get free healthcare at the point of service. Right, that's the entire point of pushing for something like Medicare for all. It's not going to be nearly as adequate necessarily as Cuba's healthcare system, but the point is, okay, the reason why they didn't have the same vaccine hesitancy as we have here in the United States is because the Cuban people trust their healthcare system. Okay, radical concept, right? But the reason why they trust it is because they don't have rapacious, mafia-like middleman, as Kyle Kalinske likes to say, who stand in the middle of you and your doctor. Okay, they have the highest per capita distribution of doctors than any other country on earth. Okay, so they have doctors that are out in even the most rural parts of Cuba that give people access to quality healthcare that is free at the point of service for them. Okay, that's how you build up over decades and decades and decades trust between a population and a healthcare system. Okay, the opposite side of that is exactly what we've seen here in the United States, where damn near nobody trusts the healthcare system that we have here, whether it's our hospitals, whether it's our health insurance companies, or even whether it's like big pharma. We all know that we're getting screwed over. It's not like, even a question at this point. It's just objective reality. We pay significantly more for pharmaceuticals than any other country on earth. Our health insurance companies have a direct financial incentive to deny our claims as much as possible, which puts more of that cost on us. And that's why medical bankruptcy in the United States is the leading cause of bankruptcy. Okay, nearly 500,000 Americans go bankrupt due to medical debt every single year. Nearly 40 to 60,000 Americans die every single year because they don't have adequate health insurance or healthcare. So these are the types of things that happen under a for-profit privatized healthcare system. Okay, that would not be happening if we had a Medicare for all type system. So again, the conspiracies that come across in the United States, okay, about people who are anti-vaxxers, right, and they say Bill Gates is putting microchips in the vaccine, or they come up with a million different ways to justify being anti-vaxxers. But the point you have to understand at the end of the day about that is that's not coming from nowhere, right? Okay, they're wrong on the specific nature of the types of conspiracies that they are putting forward, because yeah, the vaccines, even the ones that were produced by Pfizer and Moderna, they do work in the sense that they will mostly or largely prevent you from having a serious illness associated with COVID. But on top of that, okay, if people spend decades and decades seeing themselves and their family members get bankrupted and fucked over by a healthcare system, then they're going to be creating a lot of these conspiracies in their head, or they're going to be, more malleable in going towards other conspiracy theorists that are putting a lot of this information out there. So if you don't want to have the conspiracy surrounding COVID, then don't allow an actual conspiracy, meaning don't allow gigantic, profitable, pharmaceutical companies to rip people off for decades and decades. If you don't want the other wild conspiracy theories to be bred in your country, then don't do actual conspiracies. And what the actual conspiracies at the end of the day actually are just capitalism. Okay, that's the reality at the end of the day, and that's why Cuba has at least proportionately significantly outperformed the United States on not just vaccines but their entire healthcare system as a whole. But just to give you more of a perspective in terms of how pathetic the U.S. vaccine global response has been. Okay, first of all, I covered this story on my channel just a couple weeks ago. Open source vaccines got more funding from Tito's fucking vodka than the government, okay? And they are still struggling right now to get funding from rich countries. So as Cuba is developing an open source vaccine for the entire world to be distributed, damn near at cost, okay? While they're doing that, this is what the United States is doing, okay? Not only did we spend a significant portion of time trying to block the TRIPS waiver, which, even though Joe Biden says he doesn't support the vaccine patents anymore, he's not actually doing anything to take a measurable step in that direction. So, on top of that, and on top of protecting the big pharma companies and protecting their patents, I mean, they're not even funding the open source vaccines that have already been produced, okay? This was produced by some scientists at, I think it was Baylor University, and they're literally saying, we have this, we're willing to give it to all of these different production facilities around the world, we just need a little bit of help, and the US government is literally doing less than some random fucking vodka company. So listen, again, at the end of the day, we all understand the differences between the motivations of the US government. Many of our politicians here are obviously bribed by the same health insurance and big pharma companies. You could even get more specific, like Pfizer, like Moderna. These are companies that donate directly to US politicians. And another word for donate in this context is bribe, okay? Our politicians, our entire government has been fully bought and bribed by the private sector health insurance companies, by the large hospital associations, and by big pharma. So that's the result that you're going to get at the end of the day. You're going to have an increased likelihood for vaccine hesitancy because nobody trusts a healthcare system that has been fucking them over for decades. And at the end of the day, you're also going to have continued worsening of the COVID crisis because we're not going to be able to move towards like an endemic COVID, or we're not going to be able to move past having wild new variants swing in at any moment unless you vaccinate the entire world population, okay? It's a global pandemic. It's not just a pandemic for, rich people living in rich countries. So you have to take care of these entire unvaccinated populations that remain around the world right now. And a country like Cuba that has been suffering under a horrible US embargo for literally 60 years at this point is doing more than the US government, trying to donate roughly 200 million vaccines, which is literally more than the US has donated to Africa and the Middle East combined, okay? And this country in Cuba, under a US embargo, is doing more for the global health population than the United States is doing. It's an absolutely pathetic example of how fucked up the for-profit nature is within a healthcare system.